Hi everybody, let's talk about sessions. One of our major agenda items is going to be healthcare. So we are at the new medical school at Texas Tech. We're gathered here with health professionals to talk about the agenda.
The program was sponsored by Thomas & General. Two of the things that are very important to El Paso as well as the state are the physician shortage and the nursing shortage.
More physicians are moving to Texas, but more people are moving to Texas. So we're behind, and as our population grows, we are apt to fall farther and farther behind.
In terms of physicians, generally El Paso has about 2/3 of the average of the state overall.
We also have 67,000 troops and dependents coming to El Paso. They're going to create a real demand for health professionals. These are coming to Fort Bliss, so we have to recruit more than any other Texas city.
We're working on initiatives to get more doctors here. One includes allowing physicians that have licenses in other states to more easily transfer to Texas. We're also working on some bills that have to do with provisional licensing that would allow someone that's currently licensed to get a provisional license for 5 years if for some reason they would not be able to qualify for a permanent Texas license. One of the top legislative priorities for next session is to get the funding for a third building at Texas Tech that would be focused on research. Tech will focus on things like diabetes research and other illnesses specific to a Hispanic community. Things that have not really been researched before because the medical center will be the first of its kind on the border.
Supporting medical schools is an important predicate to having more doctors. And there's over 500 hospitals in the state, and yet there's only about 60 of those hospitals that are supporting residency training programs.
Residents generally practice within 80 miles of wherever they finish their program. With Texas Tech and the new medical school, the hope is that you will have more physicians that stay in the area because they study here.
Clearly, the uninsured is an issue.
Texas has more uninsured than any other state in the United States, and El Paso has more uninsured than any large American city. This is ground zero for the uninsured.
Texas, overall has 1 in 4 people in the state do not have health care coverage. In El Paso, it's 1 in 3.
We're kind of in this vicious cycle of as insurance becomes less and less affordable, more businesses, particularly small businesses, drop insurance.
So it's very important here that a lot of initiatives that are targeted towards either small employers or programs like multi-share programs that draw dollars from the federal government in a different fashion and don't necessarily involve the state. Those types of programs are key to a place like El Paso.
Texas, in spite of all the resources we put into healthcare, we generally have poor state health outcomes.
In fact, no Texas city even meets the national average, the number of people that are covered with health insurance. So what's happening? It's effectively transferring costs to locals with increased emergency room visits.
When folks go to the emergency room as their standard way of getting health care, it costs 4 times as much generally to get the same care or the same service that you would in a doctor's office. The treatment that has to be done is so much more significant than if you were able to have regular checkups with a physician.
In our view, the development of a comprehensive healthcare system that covers all Texans is so very important. We are a non-competitive state because of that now. So how we can reduce costs, provide quality care, and get many more people into an affordable healthcare system is, in our view, one of the top priority items for next session. What is so unique about what happened here today, why it's important, is that you had state officials there. You had members of our House delegation, Representative Chavez, newly elected Representative Marisa Marquez was there, Chenta Quintanilla came, you have county officials, our county attorney, Jose Rodriguez. You had city officials who have key ties back to the Medical Center of the Americas, all there visiting with healthcare professionals to talk about what do we need to do as a region to improve access to healthcare and affordability for healthcare.
Getting everyone together before session is very important to making sure that the important pieces of legislation pass and that you have enough time to actually get them through session.
I think more regions are going to need to do exactly what we did here today.